full-time prof at the School of Nursing at Fanshawe College. My primary research focus is on interprofessional education for collaborative person-centered practice, or IECP-CP, and I started, in IECP-CP research area, as a research assistant for Dr. Hochul at the University of Western Ontario, as well as, my dissertation is on interprofessional education and interprofessional socializations for IECP-CP. I'm involving in several different, research projects related to IECP-CP. One of the research that I'm involved is, engagement patients on Hospital Unit Action Council, which is, is happening in here in Perth Healthcare Alliance, and is in collaboration with Western and Fanshawe. So we are, co-sponsoring this project at here in Perth Healthcare Alliance. And the other project that I'm involved is policy analysis for IPC, or interprofessional educations, for the Ministry of Health in Ontario, and that is in partnership with the University of Western Ontario. The other project that I'm currently involved is Global Research Interprofessional Network, or GRAIN we call, that we has just published an editorial for GRAIN, introducing GRAIN to the IP award, and part of the GRAIN we have developed and submitted a new proposal for funding to CIHR, and is pending, and hopefully by June we have we'll receive good news.
I'm Tina Bonnet, and I'm a faculty member in the School of Human Services at Fanshawe College. I'm currently conducting a qualitative research study focusing on the experience for early childhood education diploma students and early childhood leadership students who are completing field practicum in an international environment. I'm looking at using Talbot's theory of transformation if students transform either personally or professionally while in an international placement. The intended impact is to hopefully better verse the college at large and faculty in terms of the outcomes for students that participate in international placement, and also the model that we use that best informs the placement and helps the students to best process their experience.
My name is Anne Lemess, and I'm a nursing professor in the School of Nursing here at Fanshawe College. The current study that I'm involved with here at Fanshawe is termed the lived experience of Aboriginal registered nurses in successfully completing an undergraduate nursing program in Ontario. And this study has been funded through the Research Innovation Fund at Fanshawe. And what the purpose of the study is to look at Aboriginal registered nurses' experiences in successfully completing their program, so which is in the title, in terms of looking at what has helped them succeed. The takeaway message from this study is that it is important that faculty are properly educated in terms of what resources are available for Aboriginal students, and also in terms of cultural sensitivity when addressing cultural issues in the classroom, that is not negatively impacting on Aboriginal students.
My name is Janice Elliott, and I am a coordinator in the School of Nursing for the bridging of internationally educated nurses, as well as international partnerships and projects. The most recent study was using photovoice to understand healthy lifestyles of Costa Rican children. Photovoice is a participatory action methodology where you're really asking the participants of the study what's important in their lives and trying to understand the themes and challenges in their lives. So we asked the children to look at their lives using a camera and taking photos of examples of healthy lifestyles. We worked with a school in Liberia, Costa Rica, and had assistance of the principal as well as elementary school teacher there to ask students to participate in our study using photovoice to understand healthy lifestyles. The takeaway message is that the participants are experts in their understanding of what healthy lifestyle is. They're experts in their community, and often they come up with the solutions to issues if we ask them. And photovoice was a good methodology in order to understand it from the participants' perspective.